So as Albert mentioned, 2020, everybody's inflection point was around the same time all over the world. And a good thing, by then we had already been experimenting with a little bit more direct patient outreach and data acquisition protocols. And a lot of things changed at that time necessarily, but a lot of things have lingered beyond that. I'm still not going in the grocery store. I never liked that in the first place. We're still having our groceries delivered, even though Whole Foods is wide open for business. And like this, too many Zoom calls in 2020, but there's a place for that. That will remain embedded in society forever. And it's more legitimized now than it ever was pre-COVID. So this world that we're in, where everybody's kind of normalized on these arm's length transactions in medical and dental, data acquisition can be done well outside the boundaries of the typical dental clinic. It doesn't require that somebody actually sit in my very expensive dental chair where I do actual dentistry. If it's just about data acquisition, we can go out and get the data in any number of ways. And when we can provide dentures to people, if that's what this is all about, right to them with sometimes them not even ever having to come into the clinic. Some of these dentures can be designed so predictably, produced so accurately, out of materials so durable and so easy to use. It can go home with them, be shipped directly to them with simple instructions, and they can do it for themselves in their own home environment and only come back to the actual profession of dentistry if they have an issue with it that we need professional hands on. So these are the kind of things that have absolutely revolutionized not just how I practice dentistry, but how I think about how other dentists should be considering it. Because it's not about undermining or turning dentistry into a middleman like Smile Direct Club tried to do. It's about complementing dentistry, taking patients and steering them towards dentistry when they actually need it, but removing the riffraff that we for generations have been dealing with on a typical patient interaction level. And now that I've got children that may or may not ever grow up to be dentists, I'm thinking about the world that they may be considering that in, and it's going to be entirely different than it was for me.